What we were trying to achieve through the HACBY program is basically to give the interns a sense of application. So we gave them the opportunity to kind of explore having the practical aspect of public health in terms of risk assessment. The broad view was on cholera risk factors.
Our start was with preparatory planning, lessons, sessions, book sessions, and different consultations with different people in the office.
To make it easy, we divided ourselves into groups using a ballot system so that it would be fair. So after we separated ourselves into the groups, we decided that we're going to Jahi 1, Jahi 2, Kado Bunkoro, and also the Jahi districts. And from there we set out to the field work.
I was able to use my skills as a point surveyor to identify infrastructural problems and some weaknesses that apply to these infrastructural problems, like the leaky pipes, wrong placement of drainages, sanitation practices in this environment.
My knowledge on microorganisms and how microorganisms grow and the enzymes they require to grow helped me know what specific environments to look out for and how this environment can help grow the bacteria that spreads cholera.
As a public health educator, during the course of the field work, I was able to do a talk and do session with some people in the community at Jahi. And during the talk and do session, I was able to know their knowledge, their attitude, and their perception towards open defecation.
Well, as a software dev or as a computer scientist, my inputs were mostly towards the tools that were used. The tool we used here was ArcGIS Survey 123. This is a collection tool that was used to pick up the data that we found on field. And this data was later represented on the map that we were using, which was the map of Jahi district.
We set up Zoom meetings to make plans and set goals for the day or for the next field work. We made sure to communicate within ourselves when we feel we are lacking or we need clarification or something, because something I don't know, some other person might know.
Accessibility was a challenge because some areas weren't motorable and they were quite a distance, so we had to walk a distance to get to these areas to map out the risk factors in these areas, and also communication barrier. For example, going to a certain location where we majorly speak Hausa, we could barely communicate with these people to maybe get their point of view and teaching them also.
During the field work, we found out that there was open defecation being performed at Jahi, and some things that could result to that was that they didn't have enough toilets. So imagine in a whole community, we only saw 2 public toilets and they were far from other houses.
My general findings were waste management problems in some certain areas, wrong placement of drainages, lack of toilet facilities. I recommend the provision of proper drainage systems and more public toilets in our community. In these areas where we investigated, we were able to find just 3 public toilets in which one was not even functioning. And I also recommend that the practice of recycling, where people turn up their waste materials and get incentives for that. This will help to make their environment more habitable for them to live in.